Welcome back to the Rx MasterClass. This video will be a comprehensive healthcare review. Let's get into it. In this video, we'll be reviewing key topics for the CPJE exam. These include medication prescribing providers, Medicare, Medicaid, rebates and discounts, small pharmacies, medication dispensing in hospital ERs, hospitals with 100 beds or fewer, HIPAA, and PHI. Independent medication prescribing providers. Providers who can prescribe medications alone include MDs, DOs, podiatrists. Retired prescribers cannot prescribe drugs. Deceased prescribers, it would be up to the pharmacist's judgment to fill the prescription or not. Other providers include dentists, veterinarians, optometrists, and for optometrists, you'll see a T at the end of their license number. They prescribe topical anti-allergies, anti-inflammatory agents, oral and topical agents for glaucoma, oral antihistamines, oral antibiotics, codeine, and hydrocodone compounds. Now, on the opposite of that, providers that can prescribe but are protocol-based medication prescribing providers include providers who can prescribe under a specific protocol. They must have a DEA number for controlled substances. Naturopathic doctors, NDs, they may schedule C3 to C5 medications. They cannot prescribe any C2s. They can independently prescribe epinephrine and synthetic hormones. And the ratio is 1 MD to 4 NDs. Physician assistants, PAs, under protocol can furnish C2 to C5 medications and controlled medications. The name of the physician is pre-printed on the prescription, and it needs the physician's date and signature as well. Certified nurse practitioners, they can prescribe under the MD protocol. They can furnish C2 to C5 drugs, and they must have a DEA number. Certified nurse midwife, they can furnish C2 to C5s, and they also must need a DEA number. They may not furnish prescription drugs from their own practice. Now, I know that was a lot of information, so let's do a quick review. Any prescription written by an ND, PA, NP, or CNM should contain the name, address, and phone number of the MD, the license number, and the signature. Mid-level practitioners include PA, NP, CNM, NDs, and pharmacists. And for C2 to C5s, PAs, NPs, CNMs are able to prescribe these per protocol. They would need a DEA number. And for C3 to C5s, NDs can prescribe these under protocol. C2 to C5 drugs must be written on a state-approved security prescription with name, address, phone number of the MD, name and license number of the prescriber, and their signature. The prescription label must contain either the name of the PA, NP, CNM, ND, or MD. Patient-delivered partner therapy. Under protocol, PAs, NPs, and CNMs can write antibiotics for their patients and their partner. This is used in diseases like chlamydia and gonorrhea. Moving on to Medicare. Medicare is administered by the federal government. It is insurance for patients who are 65 or older, treated with dialysis, or with a kidney transplant. They have a 7-month initial enrollment period to sign up. This is 3 months before the age of 65 years old, their birth month, and 3 months after they turn 65 years old. If they don't initially enroll during these 7 months before and after 65 years old, then they would have to wait until open enrollment. Open enrollment is October 15th to December 7th. Now, Medicare is broken down into several parts, so let's review each part of Medicare. Medicare Part Ae is used for hospital insurance and hospice. This does not cover outpatient prescriptions. Medicare Part B is used for medical insurance. This pays for doctor services, outpatient hospital care, and physical therapy. Medicare Part A plus Medicare Part B. This is the original Medicare. It was labeled as this when it first came out, with a flag on its insurance card. Medicare Part D covers prescription drug plans via different private insurances, optional and added onto the original Medicare. Donut hole covers the gap in coverage. Prescriptions with Part D are dealt with like any other prescription insurance company. Patients must be enrolled in Medicare Part A and or Part B to enroll in Medicare Part D. Medicare Advantage Plan, otherwise known as Medicare Part C. This is ran by private companies approved by Medicare. Patients need Part A and or Part B to get this. They have their own private prescription plan called Part C MAPD. So when a patient has Medicare insurance, they have drug coverage options through two parts. This includes Medicare Prescription Drug Part D and the Medicare Advantage Plan Part C MAPD. Medicaid. Medicaid is a federal and state program that allows and helps low-income pay for medical costs. In California, it is called Medi-Cal. Medi-Cal is California's Medicaid welfare program. Medi-Cal tamper-resistant prescriptions. All written Medicaid or Medi-Cal outpatient prescriptions must be written on a special tamper-resistant prescription blank. Special form requirements does not apply to phone-in prescriptions, fax prescriptions, or electronic prescriptions. Medi-Cal fraud could lead to 2 convictions of medical fraud and could lead to the board revoking your license. Rebates and discounts for referrals. It is strictly illegal to offer any gift or money to prescribers to send patients to their pharmacy. Purchasing drugs. Pharmacies cannot purchase drugs from nonprofit pharmacies. This is because nonprofit pharmacies get their medication at a cheaper rate. Pharmacies can buy if the total amount is less than 1% of annual sales. If a small pharmacy is out of stock on a certain medication, it can borrow that medication from a nonprofit pharmacy. Then, once the same bottle comes into the pharmacy, they would have to ship that same medication to the nonprofit pharmacy. Medication dispensing in hospital ERs. Hospital ERs can dispense a medication if there is no way for the patient to get that medication or prescription from around the hospital. Hospitals usually never give medication to patients at discharge. If medication is given to a patient at discharge, then there is a 72-hour limit supply that they can give. Hospitals with 100 beds or fewer, these hospitals do not need a full-time pharmacist. They would need a consultant pharmacist on call. The MD can dispense to outpatient directly if the medication needs to be started immediately and there's no pharmacy around the hospital. These requirements are that, again, there's no pharmacy available or accessible to the patient within 30 miles. And again, a maximum of 72-hour supply is provided. Patient confidentiality, HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. It is a federal law. Healthcare providers are required to inform patients about their privacy policies and rights. HIPAA regulates how patient information will be used and recorded, and HIPAA is kept on file for 6 years. So on the CPJE, if they ask you how long are HIPAA consent forms kept for, the answer is 6 years. Patient health information, PHI. PHI can be shared under the circumstances of POT. This stands for payment, operations, or treatment. Payment includes insurance plans paying for treatment. Operations include administrative functions. Treatment includes healthcare providers directly involved in patient care, and anyone else who is authorized by the patient could access patient health information. Thank you for watching. As always, remember to take breaks while studying, check in with yourself, review clinical topics while studying for your pharmacy law exam, and please make sure to like and subscribe for more videos like this. We'll see you next time.